Mr. Fontaine, thanks so much for joining us. Now, you're part of a group that was trying to bring medical marijuana to First Nation communities. What do you make of the government's plan to legalize pot?
Well, as you know, Cheryl, the legislation was just tabled. We're going to have a very careful look at the legislation to see what opportunities exist from this emerging market for the Indigenous community. But our focus is not so much on recreational cannabis, it's medical cannabis. And our plan is to ensure that our communities, First Nation communities, the Indigenous community, is able to access a safe, reliable health product through quality service, and through that ensure that our communities are able to participate in a significant way with this emerging sector, and in the process create wealth, engage in capacity building, ensure that the jobs that result from this business are accessible to our people, training opportunities, and that's our focus. And my company, Indigenous Roots, has engaged with the first licensed producer in Canada, a company with deep knowledge and very solid experience in the business of medical cannabis, and so that's what we're focused on, Cheryl.
And do you have any concerns about the plan to legalize marijuana?
Well, as I said, our plan is really to engage in medical cannabis. We want to make sure that our communities, the Indigenous community, First Nation communities, are able to access a safe, reliable, quality health product through good service to our communities. And it seems that, given our experience in the last while, that it's much easier for our communities and the business interest from the Indigenous community to engage in an economic sense than it is to access this in the same way that veterans, for example, our veterans and Canadians can access medical cannabis and to have it delivered through insurance coverage. We don't have the same opportunity in our community, so this is something that we want to focus on in the next while, is to make sure that we have insurance coverage for our people that need this service, and so that's the big challenge we face right now.
Yes, and make it fair right across the board. I'd like to thank you very much for your views on this. Mr. Phil Fontaine talking to us from Calgary. Thanks for your time.
Thank you, Cheryl.